Let me know when you want me to advance, all right?
Yep. Hi, everyone. Thank you for joining us. As Dr. Gupta mentioned, he is my supervisor. We work side by side together. Um, I think the one ask that we would ask of you guys is when you guys are reaching out to us because the recruitment cycle for us has officially started for class of fall 26 has officially started this week. And so both Dr. Gupta and I will be out on the road. And so if you're emailing one of us, I would kindly ask that you just CC the other person. Again, this is just because logistically we're both on the road, and if one of us misses an email, the other person will catch it. So we appreciate you doing that. Our email information will be at the end of this presentation, and I hope you guys leave with good information today. Next slide, please. Under the College of Pharmacy, there are multiple programs, one of them being the PharmD program. That is a 3.5-year PharmD track. We are the only PharmD school in California that offers that. And again, that is a 3.5-year track. We do have a international pharmacy pathway. So these students have their B Pharm from their home country. They all track in a 2.5-year track because, again, they have the degree and they're a pharmacist in their home country. So they want to practice here within the US. And so they've selected us. Their first year would be your second year in our PharmD program. We do have a PhD program that is fairly new. And as you can see, we have a Master's of Science in Biotechnology. So in short, it's MS BPS. And then this new partnership that we have with Cal Poly Pomona, it is a dual degree program. So in the case of um, for the students who are just coming straight out of community college, straight into our PharmD program, that MBA, if you do want to pursue it, would be after you graduate the PharmD program. There are special requirements for those who do have a bachelor's degree. So the students who have a bachelor's degree and meet the requirements, you can complete that within your PharmD program here at Western U. And again, that partnership is with Cal Poly Pomona. It's about 10-15 minute drive from our campus. Next slide. Um, really fun. This upcoming February, we'll be celebrating 30 years of opening. And so in 1996, two things happened at Western U. The College of Pharmacy joined, and the official name, Western University of Health Sciences, also happened in 1996. I haven't been around that long. Let's see, I would have been 3 years old when that has opened up. And but Dr. Gupta has been here for a little over 20 years, I believe 21, if not 22 years with the College of Pharmacy. I've been here for almost 10 years. And this slide is just to show that we're accredited, so ACPE and also WASC. Next slide. You guys are selecting a school, or at least interested in a school that does perform strong with the board scores. So with California, the CPJE, this is so you can be licensed within the state of California. And then it varies from state to state. So if you are interested in practicing in a different state, I'd ask that you do your research and, because there may be well, most likely there'll be a different board. It won't be known as the CPJE, but here for California, this is the law portion, and there's a clinical portion. But we have done well, as you can see, number one in the past 3 to 5 years among schools of pharmacy in California. NAPLEX, this is recognized nationally, and we've been consistent also scoring high in both CPG and NAPLEX. What you'll see is it's not a roller coaster where we do really good and then next year really bad and up and down, up and down. You'll see like a consistent passing rate with us. And that's a reflection of our faculty and the students we have in our program. Next slide. Who are we looking for? Someone who can communicate, someone who's compassionate, someone who shows dedication, who's dependable and displays good judgment. Well, how do you get that across to us? I think the communication portion, if it's not in the interview, because it will be, if it's not in the interview, it's going to be at Pre-Pharmacy Club, coming to on-campus events, you're meeting us. Word gets around. We always report on who we meet with and how the interaction was. And so, if you're someone who's not an extrovert, early on I struggled with that. there's ways to practice. I think for me, when I got into college and doing big presentations, I remember my speech communication class was about 100 students. And that was like the biggest audience at the time I ever spoke in front of. And so I just went to my local church and just spoke to the youth. It was a much smaller group, but I was able to break the ice and overcome that barrier. And so now I feel pretty comfortable speaking in front of any number of people. Um, but that would be my suggestion if, and you don't have to be like super proficient, that we're not looking for like people who are like 10 out of 10 public speakers, because we do have introverts in our class. Um, but again, for someone who's compassionate, dedicated, and dependable, this could be shown through your letters of references. So I would definitely suggest and highly recommend, think strategically on who you're going to ask for your LORs. And if you have any issues or troubles with that, I'm here to help to kind of create a game plan for you as you submit your application with us. Of course, I can't write the application for you or submit it for you, but I could help you along the way. Next slide, please. These are the prerequisites. This will be found on our website. If you've individually met with Dr. Gupta and I, we'll send you a roadmap sheet. But this is what needs to be completed in order to apply to our PharmD program. And so if you guys want to take a screenshot of this, we'll keep this up for a little bit. And just so you guys know, we do have a specific sheet with all the programs at IVC. So they're already listed. They've already been vetted. And so if you guys are interested in that, again, our email will be at the end of this presentation. Copy down our email, and then we can send that list to you. Again, and these are the prereqs with the course numbers already listed. Next slide. The block design curriculum. So this is really interesting. I can date back in my undergrad, so both at community college and 4-year. I remember when it came to a special week, you had 4 exams all in 1 week, and you're cramming the night before, and that was every single day. And it was nerve-wracking. I didn't retain a lot of information. Again, I was just cramming. And so what we decided to do for the block design curriculum here at WesternU, we pioneered this also, is you're mastering one subject at a time before you move on to the next one. So what this looks like in your P1 year, your first year here at WesternU, it's going to be an integrative block system. It won't be a full-on block design curriculum, but year 2 will be the full-on block design curriculum. Again, so you're gonna master, let's say it's diabetes, before you move on to cardiology, and so on and so forth. So you'll master one subject, you'll feel comfortable, and then you'll move on to the next one. And every so often, there's an exam. So for the last 3-4 weeks, you'll take an exam, what you just covered. And then for the next one, we're going to include the first 4 weeks and then the most recent 4 weeks. And so it's going to build on each other. So it's never going to be where you're going to learn information with the first 4 weeks and then it's kind of like that's it. That information will still kind of be in the exam. And so that is in purpose so you can retain the information, still talk about it amongst peers. And again, it's going to build on each other. Next slide. The 3.5-year PharmD program. Again, this puts us at a unique advantage. Our students will be the only cohort graduating in December. And so we are the only 3.5 PharmD school in California. It allows you to get licensed early. There's less competition for jobs. So you really get first picks when you think about it. There's competitive edge for residencies, and then you get to enjoy your summers. So for the 3-year programs, for those of you that don't know, there's 3-year programs and then 4-year programs. 3-year programs from start to finish, there's no break. You're a PharmD student the whole way. 4-year, you're going to enjoy the 4-year experience and then have breaks. We're in the middle. So we're not fully accelerated, and you'll be able to still enjoy your summers. Next slide. Our classrooms. Dr. Gupta and I, we just got done introducing ourselves along with all the other staff and faculty in the P1 classroom. We have about did that about 10 minutes ago now, and we were here. So there was a PowerPoint a presentation, and there's a full-on 360 view of the presentation throughout our classroom. This presentation can also have direct access to our breakout rooms within the College of Pharmacy. So from time to time, you will work for on group projects throughout your experience here. It may be too noisy, and the faculty might say, hey, we want you to go to the breakout rooms. So you break off individually. It's more secluded with you and your team, and that information will still be shared into the breakout room. So it's not like where you have to print out something or someone has to download it on their laptop and pull up the presentation, hook up HDMI. We have the capability of just sharing whatever is in the P1 classroom throughout the building in the breakout rooms, which is a pretty neat feature. You will be placed in teams. So this isn't to say that you are designated to sit in your team throughout the P1 class. It's only in teamwork or team-based projects is when you're in your team. We've been asked in the past, well, how do you guys determine who's in which team? There's a personality test that each student takes, and we structure the teams based on personalities. And so what we tend to find effective is we're going to pair you up with students who think differently than you. Maybe students with different personalities. And why do we do that? Because if you think about it out in the workforce, not everyone's going to have the same personality as you. Not everyone's going to think alike, right? So then how do you come to an agreement on a project? And so how do you balance different personalities? And so we find that effective. And I think on top of our OSCEs, which WesternU, we hire actors. So apart from this classroom, we're putting you into a mock scenario where you're learning the information in the classroom, but now you got to put it into practice. And then what better way to practice than doing mock scenarios? So it's recorded, video, audio. You're going to get direct feedback from faculty at the beginning. And then at some point in your pharmacy experience here with us, we're going to put you to the test. You know, how personable are you? And then you'll get coached on that. The information that you're learning in the classroom, that'll be put to a test during these OSCEs. Again, these are paid actors, so these are people who aspire to be actors or actresses. They're going to yell, they're going to scream. Like they're literally going to, it's going to feel real. And our students get pretty nervous when they do that. But after the first two, they kind of like figured out the system and they really enjoy it. I share that because I think our classroom setup and our OSCE setup, a lot of the preceptors, a lot of employers, they love our students. I think what we do here does build confidence, and our students shine out when they're out in rotations. Next slide. Of course, you're going to have an early introduction to clinical work. This is going to happen in your P1 year, also P2 year. So it's going to start right off the bat. Again, don't worry, it's not going to be where we're going to push you out in the deep end. You have no idea what you're doing. It's not that type of feeling. We're going to prepare you as you go throughout this experience. But as you can see here, there's going to be 4 weeks in the summer at a community pharmacy. And then year two, for that second bullet point at the bottom, it'll be 4 weeks in a summer in a hospital pharmacy. And again, this is just early introduction into the clinical space. And we have a dedicated team who they do all the outreach, they do all the agreements, they approve sites. So let's say if you want to do, there's in-state, out-of-state, and there are rotations that are international too. There's a CCAPP student who just got back from Japan. And so he was spending about 4 or 5 weeks out in Japan, and he's pretty active on social media. So Dr. Gupta and I were able to see how much fun he was having. So you get to travel internationally during pharmacy school and get credit. And so again, I think for the IPPEs, it's a great introduction to kind of get your feet wet. And then for the next slide, we'll talk about our APPEs, which is the advanced pharmacy practice. So as you can see here, there's a list of rotation sites. You just let our staff know. So it's the OEE office. You just let them know what state you want to go into. So let's say you want to go to Texas, 'cause you have family there. And if you want to stay with family, that's totally up to you. Um, but they do the outreach. Again, they're going to approve it if they're not already an approved site. We do have sites in Hawaii. And so that's totally up to you where you want to go. You just let them know, and then they'll let you know what's available. Um, for the longitudinal advanced elective, this one's pretty unique because there is a component where you're able to do a business plan. This is kind of my favorite because I get to see students create the business plan. I hear of it. And then when they graduate, they're out in the workforce. And the first thing they do is they take their business plan, they copy and paste it, literally what they've worked at in graduate school, and they apply it to the real world. And they create their own pharmacy. And so there's an alum who did that in Burbank, and he reached out, and there was a little bit of a grand opening, and he invited us to it. And so I remember that student in our pharmacy program, and it was just so cool to be there and to kind of enjoy those pictures because it's something that he worked at graduate school. So had he had slacked off in graduate school creating that business plan, it probably wouldn't have been effective thereafter. But he did a good job, and we're proud of all the students throughout this program. And so that's more of an entrepreneurial route. And so that's entirely up to you if you want to do that. If not, there's other electives that you can take during that time frame. Next slide. This is one thing beyond today, beyond join pre-pharmacy club. And so I'll share quickly that pre-pharmacy club is open to anyone. So whether you're a parent, you're a counselor, you're at a career center, you're a student, whether it's community college, four-year school, whatever the case is, even it's open to the younger siblings or younger family members in your family. This is something for pre-pharmacy club where we want to educate everyone what pharmacy is. So what we do is we recruit an alum, and then they share what they do with their PharmD degree. And that's really all it is. Every quarter, it's an in-person event. For the in-person event, you will be fed, and then there will be raffles. And it's my understanding, because all last year it has been, but there's always a Zoom option. And the reason why we have the Zoom option is maybe transportation issues, maybe it's too far. And so we do have students from other states who join us for the pre-pharm clubs. Preview days, this is so you get a better understanding of what happens on campus. And so we would invite you to preview days. It's my understanding this also happens every quarter. And you're going to come to campus, you're going to get familiar with the classroom, you're going to see it in person, you're going to see it live in action. It's either the dean, Dr. Gupta, or Dr. Chan, who will be doing the presentation. So if the dean's out of town, if he's in a business trip, Dr. Gupta or Dr. Chan will replace him. But it allows you to meet faculty, current students. There'll be a panel of current students, so they'll be answering your questions. You'll learn more about the admissions process. I believe financial aid is also available during that day. And so it's a great opportunity, again, for you to get more familiar with us and then just to get a live look of what happens on campus. Next slide. And now I'll pass it over to Dr. Gupta. So I thank you guys. At any point, if there's any questions during the presentation, I'm sorry I didn't monitor the chat, but we'll look at it right now to see if there was any questions while I was presenting. If not, I'll pass it over to Dr. Gupta. And same thing, if you have any questions for Dr. Gupta, we'll be more than happy to answer that as we go.
All right, thanks, Ben. So, Ben, one thing real quick. If you can put in the chat and maybe just say it out loud because this recording will be on YouTube, and I don't know if they probably can't see the chat. But I forgot. I don't know what happened to the Pre-Farm Club slide. I guess I deleted it by accident. But what is the handle for WesternU Pre-Farm Club on Instagram? It's at WesternU Pre-Farm Club, correct?
Yes. So WesternU Pre-Farm Club, and I'll type it in the chat. But farm is going to be PHARM.
All right. Yeah. So thanks. To Ben's point earlier about Western Pre-Farm Club, completely free, completely voluntary, no commitment. Just join the Instagram so you can see what different speakers are coming. We have different alumni speakers coming to talk about their unique role in pharmacy. Pharmacy is such a diverse profession. That's sort of what this slide deck that I present to you will talk about, about the profession in general. But you'll actually get to meet real pharmacists who are doing these different things and kind of learn from them and also, ask them questions and all that kind of stuff. So just, sign up for at WesternU Pre-Farm Club to kind of, join the fun there. All right. With that being said, I'm here to talk about pharmacy as a profession. I'm once again Dr. Gupta. I'm a PharmD. Graduated a long time ago, the year 2000. So I've been a pharmacist for 25 years. It's kind of crazy how time flies. I've been at Western U for 21 years. And so feel free to shoot me any questions about pharmacy or Western U or whatever you like. So if you guys don't mind, typing in the chat real quick, when you hear the word pharmacist, what comes to mind? Oops. Medications? Anything else? All right, not too much chat activity, but yeah. So people think pills, medicine. Often I'll hear like CVS, something like that. And so that's kind of what people think. And so, understandably, for the most part, the public's interaction with the pharmacist is seeing the pharmacist at their local drugstore, and so that's kind of what you think of. And so, what people seem to think, so people seem to think that pharmacists just count by five and put pills from a big bottle, put into a small bottle, and give it to you. If you guys have seen Seinfeld on Netflix at all. There's there's this little skit he does before one episode where he says, oh, I don't get these pharmacists. They're so high and mighty. What makes you a doctor? All you do is take pills from a big bottle, put into a small bottle, and give it to me. And I would agree with him. If that's all pharmacists really did, then yeah, I mean, I would agree with the assessment. What's the big deal there? But that is actually not what pharmacists do, right? So what pharmacists do, pharmacists are the trusted medication specialists on the healthcare team. We help patients get the best results from their medications. And medications are complex, and medications, even though they're meant to help you, they actually might harm you. And so, if you don't know how to take the medication correctly, or if that medication is not screened against your other existing medication or against your other disease state that you might have, a medication that was given to you with the best of intentions might actually cause the worst of intentions, or not the worst of intentions, but the worst of results, I should say. And so so pharmacists help improve healthcare outcomes and also lower costs. So medication misadventure is a top 10 cause of death and disability in the US. And so that's going to be, a drug that causes, that ends up having a drug-drug interaction or a drug disease or even a drug-food interaction that causes harm. And so, preventable med errors cost the US healthcare system about $20 billion annually. And pharmacists are here to prevent these things from happening. And we are extremely accessible to the community. And, you can see that at your local drugstore. We get all kinds of questions. We can help the public in many ways, not just through, screening drug therapy. So what pharmacists really do is we prevent cures from becoming killers, and we do that through education. We do that through clinic-based pharmacy as well. We actually help patients optimize their disease control. We also do that in the inpatient space by, creating IV drugs and other medications through the right process, through sterile means, so, those medications don't harm you. You guys are, once again, probably too young to know of the NECC, the New England Compounding Center fiasco. This was a compounding pharmacy out in somewhere in the East Coast. And they, their specialty was making intrathecal drugs, so drugs that were injected into the cerebrospinal fluid to treat meningitis. There's a lot of rigorous policies and procedures to follow when you do these kinds of drug therapy. It's considered high risk, and they unfortunately did not follow their procedures, and they allowed mold to grow in their clean room where they made the medicine, and that mold unfortunately got into the product, and so they were introducing fungus into people's cerebrospinal fluid, caused, I believe, 20-something deaths and many more injuries across the nation. And so ever since then, the policies got even much tighter. In California, we get inspected every year if you have a sterile compounding facility. And so, once again, pharmacists need to follow all the rules to make sure that the medication intended to help someone will help them and not harm them. So at Western U, we also are forward thinking. We don't want you to be a pharmacist of today. We want you to be the pharmacist of tomorrow. So we kind of wonder, where is pharmacy practice going? If you're not aware, there is a primary care shortage on the physician side. It's been that way for a long, long time now. Even though they've instituted many measures to improve that, there still is a primary care shortage. Because if you think about it from the physician side, if you're a physician student, you want to, you're in school, 4 years undergrad, 4 years med school, 3 years residency, if not more, if you specialize. And, you want to maximize your own investment in yourself. And so specialists make more money than general practice. And so most physicians are incentivized to continue to specialize, draining the primary care pool. And so since pharmacists are already in every community, and we have a really strong knowledge, of course, of drug therapy, but of disease as well, we can see pharmacists moving into that primary care space as the initial triage. And so at Western U, we already started for, I want to say, 6 or so years now. We already started training our students on physical assessment. And this is Jackie as a student, Jackie in the real world, using those skills on a patient. Because as the profession changes, we can see pharmacy moving into the primary care space. We want you to lead the change and not be left behind when it changes. So it's kind of hard to do this exercise over Zoom, but you can do the thumbs up kind of button if you will. How many of you think pharmacists can compound a medication? Compounding medications is taking medicine from their raw materials and making an actual product out of it. Anybody? All right, so the answer is yes, right? Pharmacists can do that. That's really old school pharmacy. That's all we had back then. But then, of course, we got commercial manufacturers. But there's still some patients who cannot take commercially made products. They need patient-specific products. And so there's some niche compounding pharmacies that make the medication for them. Compounding pharmacists also fill the gap when there's shortages. If you guys are aware of Wegovy or Ozempic, those weight loss drugs, there was a national shortage of those drugs. And so compounding pharmacists filled the void. They were able to create that product. Normally, it's illegal to create a commercially made product, but when there's a shortage, the FDA will allow it. And so, they filled the void making that product while there was production issues on the manufacturer side. And then when those resumed, of course, the FDA said cease and desist making the product, and so they did. Also, can pharmacists dispense medication? Thumbs up, anybody? So the answer is yes, right? That's what you see all the time. It's a CVS, etc. And so what you don't see is pharmacists on the back end of it screening that prescription for making sure it's correct for you. If prescriber tries to kill you, I mean, mostly not intentionally, but by accident, we're fixing that problem on the back end before you actually get the medication. So, what you see is the dispensing part, but we're doing everything on the back end to make sure it's right for you. Do pharmacists counsel on medication use? Thumbs up, anybody? So the answer is yes, right? So that is actually legally required by law over 1990, mandated counseling on any new prescription. So refills are not mandatory, but you can always ask as a patient. But any new prescription, you should get a consultation to know how to take that medication correctly so it doesn't harm you. Do pharmacists prescribe medications? Thumbs up, anybody? So less thumbs up here. The answer is yes. So in California, pharmacists can prescribe. So not all pharmacists. So there's a handful of states that have advanced pharmacy practice laws. California is one of them. It's, as far as I can recall, California, New Mexico, North Carolina, and Washington. There could be more, but those are the four that I'm aware of. But so after you get you graduate from pharmacy school, you pass your base licensure exam. There's actually in California a secondary licensure exam called Advanced Pharmacist Practitioner. And if you pass that exam, you will then have prescriptive authority. And so you have, more essentially free reign to be your own provider. And as I said, that's where pharmacists are going to move into that primary care space. You'll have those abilities as well. So do pharmacists give vaccines or injections? Thumbs up, anyone? The answer is yes. I mean, COVID, a horrible thing for the world, a really good thing for pharmacy in the sense that it highlighted, our utility in the healthcare system in the public. Because when COVID happened, a lot of physicians shut their doors. Pharmacies never shut their doors. We were out there taking care of the population, and we were giving most of the COVID vaccines. In fact, the analysis after the big peak and wave of COVID was over, was that pharmacists gave over 50% of all vaccines to combat COVID. So do pharmacists take vital signs? So the answer is yes, we can do that. So, pharmacists, do work in the clinical space. Even if they don't, we have the right to take vital signs and we have the authority, a scope of practice to do so. Do pharmacists manage chronic care disease? And the answer to that is yes. So that's actually what I do. So, of course, I'm in academia. I'm an assistant dean, but I have a practice site, which is what we call AmCare, ambulatory care. And so I manage patients with diabetes, high cholesterol, high blood pressure. I don't get the easy ones. The easy ones the physicians can take care of. I get the hard ones. Physicians unfortunately have time constraints to their visits. And when a patient has many problems, they kind of take care of they rank order the problems by severity or acuity. And they take care of the most pressing issues first. And if they run out of time, they say, well, next time you come in, we'll take care of that chronic problem. Sometimes or oftentimes those patients are no-shows or the patient has a new acute problem. So these chronic care diseases, get left by the wayside. When they're easy to treat, of course, they see high cholesterol, here's a statin, Cholesterol goes down, no problem. But when that simple formula doesn't work and they're hard to treat, those patients get uncontrolled. And so I get referred those patients to manage. And so it's a lot of fun because they're difficult. It's putting that puzzle together to get them controlled, and I am able to get them controlled. And so, the patients are super thankful because they feel like, no one can help them. Of course, we can help them, and it's a great place to work. Okay, so pharmacy has changed over time. As I mentioned, originally it was just like the powders and the liquids. We actually had to make the product, old school pharmacy, and then it was commercially made, and then of course a more modern version of that. And then over in 1990, mandatory counseling on all new prescriptions. And then this, I didn't really talk about, but this is showing medication therapy review. So the Medicare Modernization Act, I forget the year, 2006, 2008, now will pay pharmacists for a consultation when a patient has a complex drug regimen. Of course, we are a sort of senior heavy population, right? The whole baby boomers have aged up. And so when the older you get, more than likely, the more diseases you pick up and the more medications you're on. So when someone has three chronic diseases, and I believe it's seven or more chronic medications, then that will trigger a pharmacist-led medication therapy review to make sure that there's no duplication of therapy, or you make sure you're taking the right medicine for the right indication, no drug disease interactions, et cetera. And so we've been able to improve a lot of healthcare and also save a lot of money through that process. And then now the sort of next iteration of pharmacy practice is pharmacists are now decentralized in the health system setting, the hospital setting. We used to all be in the basement of the pharmacy, with the central pharmacy, filling cards, screening for appropriate orders, making sterile compounds, etc. But now pharmacists are out on the floors, seeing patients with the team. Renal dosing is a big thing. When someone is sick in the hospital, their kidneys don't function normally, their liver doesn't function normally. The kidney and liver are the two main organs that sort of process drugs you ingest for excretion. And so if those don't work normally, excuse me, then the medication can't accumulate in the bloodstream. If we give you the usual dose every day, that's going to cause too much accumulation and then toxicity. And so pharmacists screen all the patients for their renal function, and if it's not, the kidneys aren't functioning well, they'll adjust that medication downward to avoid that toxicity, things of that nature. There's also a few what we call narrow therapeutic window drugs that too little, it doesn't benefit you, too much is toxic. And so, most hospitals now have gone to letting pharmacists just prescribe those medicines because we know how to calculate the right dose for the patient. And so that's kind of how pharmacy is changing, moving more to the clinical side and away from and away from the dispensing role. Okay, so as I said, pharmacists are spending less time dispensing drugs and more time providing patient-centered services. Transition of care is a big one, and so that's kind of you might wonder what I said previously. You know, duplication of therapy. Why would someone be on multiple medicine of the same kind of medicine? Trust me, it happens. A big issue is insurance. So of course, medications are expensive, and people can't afford them, so they need insurance. Not a problem. But insurance has what they call a formulary, which is a preferred list of drugs that the insurance will pay for. And they won't pay for drugs off the formulary list, or they'll charge a higher price, et cetera, anyways. And so someone at home is on their insurance's preferred formulary drugs. If they get sick and get admitted to the hospital, the hospital has their own preferred formulary. It's not always the same as the insurance. And so the hospital will convert all the patient's home meds to their preferred list of meds, if you will. And then when they get discharged, the hospital doesn't know what everyone's insurance is. Well, they know, but they don't know what their formularies are. And so they'll discharge them on the preferred hospital list of meds. But then when they get home, their insurance wants to convert those to the insurance preferred list of meds. And it's confusing for the patient because they'll say from the hospital, well, I should be on simvastatin, but I'm on atorvastatin. Well, why am I not on simvastatin? And not realize it's two of the same kind of drug. And so they will end up, getting the simvastatin filled somewhere also. And they'll take Simva and atorvastatin, which is two cholesterol medicines doing the same thing. And when that happens, you don't get extra benefit. You actually get more toxicity. So they'll end up getting muscle pain, memory loss, whatever it might be, and then they'll have a problem. And so transition to care pharmacists will streamline those discharge meds to their home meds to avoid these problems from happening. The hospitals are interested in that because if they go home with a complex regimen that puts them back in the hospital won't get paid for that secondary admission. So they want to make sure that the patients are doing well at home. Um, Adherence is a big thing, honestly. Many times patients are prescribed the right medications, they just don't take it. My neighbor's like a second dad to me. And when I go back home and visit my real dad, I'll go visit him as well. And one time he said, hey, like my blood pressure's out of control. Can you help me? I said, yeah, for sure. And so he showed me the meds he was on. He was on very strange medication to treat blood pressure. Normally, there's like, there's this whole hierarchy of medications you use. And the ones he should be on, he wasn't on. He's on like really end stage meds. I'm like, that's a very strange regimen. I said, well, what about this drug, this drug, this drug? He said, well, maybe it's those. And he points to his fridge and he has a paperclip magnet thing on the fridge of all these unfilled prescriptions. And those were all your usual, suspects for treating high blood pressure. I'm like, oh my gosh, like your MD thinks you're on all these meds and that your hypertension is resistant to them. So he's put you on these more sort of obscure meds that treat that treat hard to treat blood pressure. But if you just take these other meds, you'd probably be controlled. So you need to go tell your physician you're not on all these meds, and they need to sort of redesign your therapy. And so that's what he did, and so things got better. But so adherence, caused that problem, right? And so adherence, well, sorry, not adherence, I should say, caused that problem. And that's a big issue with patients. Patients need to take their meds, and that's part of the pharmacist counseling is that we need to help the patient understand why they should take their meds and how to take their meds. Okay, MedSync, I don't really have time for. Specialty pharmacy is a fun one. So specialty pharmaceuticals are either super expensive drugs, of which the payers are scared of paying for because it costs so much money, or super toxic drugs. There's some disease states where we don't really have good medicines to treat that disease state. We have some that are also very toxic. And so the FDA approves them under what they call a REMS program, which is Risk Evaluation and Mitigation Strategy. And so the patients can get the medicine, but they have to be followed by very closely by a pharmacist who will make sure they get all their monitoring labs in to make sure that they're not being harmed by that medicine. And so that's kind of specialty pharmaceuticals. So on the fun question I have for you is put in the chat, what do you think in dollar amount is the single most expensive dose of a drug in dollars? What do you think? Just kind of throw some numbers at me in chat. Anybody? In dollar amount, what do you think the most expensive drug is? Nobody? There we go. We got some takers. $2,000? $50,000? All right, so the most expensive single dose of a medication is $1.2 million, right? So the top 10 most expensive drugs are $800,000 and up. I mean, they are unique. They're gene therapy, so not a lot of patients need it. But if you have a genetic disorder, these drugs can correct that genetic disorder and give you a healthy life beyond that. And so that's why they're so expensive. From the insurance's standpoint, they would rather pay $1.2 million for the drug instead of pay for a sick person for 40, 50, 60 years. So it sort of makes sense, right? I mean, the more common expensive drugs are going to be like, I would say, so to treat hepatitis C is about $100,000 for a course of therapy. A lot of, cancer drugs, you're looking at 10, 20, even $50,000 a cycle. If you heard of IVIG, that's immune globulin, that's about 40 to 50,000 a cycle, depends on the dose. And so those are your more common expensive drugs. But, your super expensive drugs are going to be $800,000 and up for one single dose. Okay, so pharmacists do chronic disease management. I talked about that. That's what I do, right? Of course, we give education and we give vaccines. We talked about that already. Oops. There we go. So, so where can you work as a pharmacist? Of course, community pharmacy and hospital pharmacy are the biggest employers. I mean, every community needs a pharmacist. And so there's, the big chain stores like Walgreens, CVS, et cetera, Ralph's. And then there's also the independent pharmacies, which those are the individual business owners, which Ben had talked about. If that's your interest, we have a plan for you when you're in your last year to make a business plan to learn the ins and outs of how do you build your own pharmacy. You can do very well as an independent pharmacist. You can make, anywhere from 100,000, 150,000 a year to millions and millions a year. And we have a few alumni and a few supporters who are in that $1 million range who've been very generous to support the college. So hospital pharmacy, every community needs a hospital. Every hospital needs pharmacists as well. And so it makes sense that these are your two biggest employers. And then, other areas you can work, compounding pharmacy, I've talked about, where, you're actually making medicine from the raw ingredients because, a patient cannot take the commercially made medication. Or specialty pharmacy, of course, those high cost or high risk drugs, you have to monitor those very, very closely to make sure that the patient is taking it the right way, using it the right way, storing it the right way, and not not suffering toxic effects of that medication. AmCare Pharmacy, that's what I do when I'm not in school. So that's managing chronic care disease in my clinic. So, where I'm at, there is no medication. I don't have medication where I am, except for whatever the patient might bring in with them. But I'm the one assessing their disease control and then starting, stopping, changing therapy, ordering labs, referring to other specialists, if that's what the patient needs. So I'm managing that chronic care disease. So in my practice, it's diabetes, high blood pressure, high cholesterol, but there are other practices that do pain management, pulmonary disease, I mean, you name it, right? And so pharmacists have really grown in that AmCare space. Nuclear pharmacy is a fun one. I mean, in most pharmacy settings, you have to love talking to people. If you really hate talking to people, but you want to be a pharmacist, nuclear pharmacy is for you. You talk to nobody. So all those diagnostic tests that you do in a hospital, those all need a certain radioactive drug that's actually administered to see how the heart beats or et cetera. And so those, diagnostic sort of drugs are drugs. And so we need pharmacists to make them and oversee them. And so nuclear pharmacy is your day starts at 4 a.m. because those drugs rarely last more than a day. And so you make all those drugs by noon and send them out to all the hospitals for use. And so that's a pretty interesting field. The prescription insurance companies, which is what we call managed care or pharmacy benefit managers. And so this is also a field where you don't really talk to patients, but you do work in, teams. And so you talk to other professionals, if you will. But your job is to make sure that your insurance plan can cover all the lives you cover with the best medicine. So you can't always pick the best medicine. If you chose the absolute best medicine for every disease state, you'll probably run out of money and not be able to care for people in your plan. So you have to say, okay, based on the pool of money we have and based on all the data that we plugged into these Excel tables and these decision trees, et cetera, that we can cover the second best drug for heart failure, the best drug for hypertension, the best drug for diabetes, et cetera, right? And so you have to sort of decide on these are the people who create the formularies. You have to decide on the formulary what your preferred drugs are, so you can cover the most lives under your plan in the best possible way. Other pharmacists on the managed care side, they also will be the approval pharmacist. So, sometimes the providers will write for a drug not approved on the plan. And so, there may be a legitimate medical reason for that. And so pharmacists are sitting there, doing what they call prior auth, approving these authorization requests to take these off formulary medications. Pharmacists can also work for the government. You can work in the FDA. We have an alumnus, Ruben Ayala. He's out there. He's a director of drug policy out there for the FDA. So, he helps set drug policy for the nation. Of course, you can work in the VA, the correctional facilities. You can work for governmental, counties, city facilities, or the prison system even, right? That's correctional. And so, these are governmental ways where you can work as a pharmacist also. Um, my wife works at county hospital. She's a nutrition pharmacist. So in county hospital, you get patients who are pretty sick. They can't eat physical food because they either have stomach cancer or some kind of cancer, or they, got a gunshot wound or a motor vehicle accident, so they can't eat physical food. So my wife designs that IV nutrition. She rounds with the team, with physicians, dietitians, nurses, etc., and she helps design that IV nutrition for them, right? So of course, too much glucose, they can get diabetes. Too little, sorry. Actually, too much insulin, they can get hypoglycemic, this is low blood sugar. Too much insulin, right? So too little insulin, their sugar is not controlled. They can have diabetes. They have too much potassium or too little potassium, that can cause an arrhythmia, which could be very devastating, et cetera. So she has to monitor all these things with the team and design that nutrition with them. So academia is another role. That's what I do, of course. I'm assistant dean at WesternU. But in academia, if you love, imparting knowledge, teaching students, etc., this is a great field for you. Another growing area is the pharmaceutical companies. And so working for like Amgen, Allergan, Pfizer, you name it, they employ a lot of pharmacists. It's a pretty good field. You have a good work-life balance. You get paid pretty well. You get stock options, bonuses, company car, you name it. And so it's a growing area of interest for our students. And so we definitely have a way to prepare you to go to industry. We have a lot of successful students in industry at this time. Okay, so here's just some examples of work settings. So community pharmacy chains, CVS, Walgreens are probably your biggest one. You have Ralph's. I know Rite Aid just closed. You have independent stores. These are your mom and pop stores. So you as an independent owner, kind of are that pharmacist for your community. The hospital setting has outpatient side, also the inpatient side, making sterile compounds, filling all the carts. Of course, all the decentralized model I'll talk about next, I think. So long-term care, I never really discussed. So long-term care are people who are sick enough to need a higher level of care. They can't go home, but they're stable enough to not need to be in a hospital. A hospital stays about $2,000 to $3,000 a day. So if they can avoid that cost, then once they're stabilized enough, they get transitioned to what they call a SNF, a skilled nursing facility. That's long-term care. And so, of course, there's pharmacists taking care of the medications in that setting, but also there's pharmacists that round on all the patient bedsides to make sure that they're getting all the right medications for their indications, make sure there's no drug-drug interactions, drug-disease interactions, you name it, right? So pharmacists will have a consultant role in that space. And of course, as I mentioned, pharmacy role is evolving. And so, there's now a lot of clinical pharmacists in the hospital setting. So they are not in the central fill area. They're out on the floors. They run with the medical team to discuss patient cases. They optimize prescribing choices. They will, recommend ordering the relevant lab tests to monitor drug therapy or drug toxicity. Do the transition of care thing for patient home medication. And also, they'll convert, so as I mentioned, if someone has poor kidney function, they'll reduce doses, or if their kidney function recovers, move the dose back up. Same thing with the liver. If someone, is on IV medicine, but now they're stabilized, converted to oral medication. And then every hospital needs to have an antibiotic steward. That's actually a California law. And so that's someone, they're usually pharmacists. They actually can be nurses sometimes, but there's usually someone on the team who monitors all the antibiotic therapy to reduce overprescribing. And also, in this way, it'll reduce the resistance forming to the medications. If we don't have usable medications to combat infectious disease, then we're going to be in a lot of trouble. And so it's their job to make sure that we're using antibiotics, antifungal, antiviral therapies effectively and not overusing them. Okay, but so there's different specialties now for clinical pharmacists in the hospital setting, internal medicine for floor, ICU, pediatrics. ER is a big one. If you like the whole adrenaline rush, rock and roll, people are coding, they call for the crash cart, you run in there, make the epi, make the atropine, try to stabilize and save lives. So, there's a lot of fun roles for pharmacists out there. Okay, so reasons to consider becoming a pharmacist. Pharmacists are one of the most trusted healthcare professionals. We have a good work-life balance. Posts like physicians on call every 4 days, etc. There's no on call for pharmacists. I know some pharmacists that do take on call, completely their choice. There's no job that requires on call for pharmacists. Pharmacists make good money, right? 140,000 to 175,000 a year out the gate. So once you finish pharmacy school, you can make that salary depending on where you work. And so, it's a pretty good salary. But as I said before, my favorite part is we make an impact in patients' lives every day. As I said, in my clinic, I get the hard to treat patients that feel like they have no hope. I'm able to fix them. I take some work, obviously, it's not like instantaneous, but through some work together, we can fix their problems. And when they do get controlled for these chronic care diseases, they're just so happy that they now can see light, right? And so I get very nice cards thanking me. I get, flowers, food, etc. It's kind of nice of patients to just be so thankful and kind of give back in that way. But hopefully what I kind of showed you, what you may have thought about pharmacy walking into the presentation, the pharmacy degree is very versatile. There's very different fields within the pharmacy profession. And so based on your own personality type, you should be able to find a niche that matches your interests. And so, definitely, hopefully this presentation made you more aware and more interested in what pharmacy has to offer for you. Okay, so lastly, I do want to talk about the partnership that WesternU has with IVC. And so WesternU and IVC, back in, I think, 2022, if not 23, we signed the agreement, which is called CCAPP, the Community College Accelerated Pharmacy Pathway. And so this is a fast track for students at IVC interested in completing their Doctor of Pharmacy degree at WesternU. I actually see one of our CCAPP students on the call. So, hey, how's it going? I'm not going to out you. You can out yourself if you want to. But so this is a transfer admission guarantee to WesternU. If you, of course, complete all of our prereqs. So, you're completing all the prereqs, all the same requirements that everybody else has to complete. But as long as you have a prereq GPA of 3.0 or better, and you also meet all the other prereqs, all the other conditions, which is a C or higher in all prereq courses, application through PharmCast, 2 letters of reference, no academic student conduct violations, then you'll get a guaranteed seat at WesternU, right? So if you somehow fall below a 3.0, or you maybe do have some issue that happened early on, but you've seen the error of your ways and corrected it, you can still apply. The seat is not guaranteed. We'll have to review your case and kind of look at that, all right? But so the CCAP program, if you're just starting out at IVC, I know everyone's in a different space, but if you're just starting out, you can knock out all your prereqs in as fast as 2 years. We do not require a bachelor's degree at WesternU. So you can knock out all your prereqs in as fast as 2 years and then come directly to us and start your pharmacy career. That'll save you time and money. If you think about it, you don't need to spend education costs at a 4-year university. You also don't need to spend the time. What I showed you in the previous slide, pharmacists make 140 to 175,000 a year. Every year of time saved is another 140 to $175,000 in your pocket. Although Uncle Sam will take about 33% of it. But so that's actually a pretty good deal. And so if you guys are at IBC and you are interested in pharmacy as a career, contact myself and Ben. And we can help fast track you to the WesternU Doctor of Pharmacy program, provided you meet all the conditions on your end of it. Okay. With that being said, IBC has been a great partner for us, and they have set up a bunch of transfer appointments if you're interested in taking the next step and learning more about the CCAPP program. So Vanessa might be emailing you this information as well, but I'll leave this slide up for a bit so you can take a screenshot or take a picture, and then contact Vanessa at the transfer center to set up an appointment. Okay, but you'll be talking with Ben or myself or both of us. I think probably both of us for the most part. And then also, if you want to, jump on our Instagram, is here, WesternU PharmD, and here's our website to learn more.